it has been a busy month at the state capitol as some Texas businesses get the green light to slowly reopen.
So joining us now from Austin is Governor Greg Abbott. So Governor, it's been exactly 2 months since you signed that public health disaster in Texas, and this week you extended that order. So when do you expect to lift it?
Well, it's been lifted to some extent already. Remember, the stay-at-home order has already been lifted. It was lifted in the past executive order that I issued. Now we're going about the process of opening up more and more businesses. The next order will be coming out this next Monday. So what I'm doing this week is I'm meeting with our team of medical doctors who are advising us about the safe ways to continue to open business. As you know, as we speak right now, retail stores, restaurants, and things like that are open up, as well as hair salons and gyms will be open up effective this coming Monday. And so what we will be doing on this coming Monday is considering announcing even more opening of business in Texas.
All right. Well, you know, some have said that COVID-19 cases have peaked in Texas and we're flattening that curve. But several counties here in East Texas, including Gregg County, Governor, where you grew up, have reported more cases in the past week than the week before. You know, with your plan to slowly reopen businesses, was this case spike expected, or what do you have to say about that?
So here's the way the case count will look across the state as we move forward, and that is there will be certain counties at different times where there may be an increase in that particular county. Now, we have these surge teams that go into different regions to make sure that whatever the cause of the spike in a particular location, it is fully addressed, fully mitigated, and everything is back to normal. Some easy examples. Let's go further east over to Panola and Shelby County, where there was a spike because of some meat processing facilities there. Go to the Panhandle. There was a spike in Amarillo and just north of Amarillo because of some meat processing facilities there. Same thing with regard to Grayson County and Sherman. We put teams in all of those locations to bring down that spike. Let me tell you, there's, in addition to meat processing facilities, there's jails and senior living facilities. Those are the three big areas that we have these surge teams working on. Those are the three areas where about 50% or more of the deaths arise from. Now, all that said, know this, because just before coming on, I looked at the hospitalization rate for the Tyler and Gregg County area, and it's great. Today, you're at the lowest number that you've been in the past 10 days. And so as far as hospitalization is concerned, as far as deaths are concerned, things are looking very good in East Texas as well as the entire state of Texas.
Governor Abbott, you know, as the economy slowly reopens, we're constantly being told that we have to adjust to this new normal, accepting a permanent change to the way we live our lives here in Texas. You know, that way of thinking doesn't really sit well with a lot of East Texas viewers we've spoken to. In your opinion, Governor, do you think we will ever get back to just normal?
Sure, we will be back to normal, and we know the time when that will come, and that's when the immunization will be available. And so what we need to do is to bridge a divide between where we are now to the next medical step, and the next medical step will be when medications are available. And that should be in just a few months down the road. It could be August or September, maybe even before then, where either by injection or a pill you can take a medication. Then after that will be an immunization. When that will be, I can't tell you, but probably sometime next year. But we will be able, between now and those times, be able to continue to open up. But because this is an infectious disease, it will be necessary for people to continue these safe practices. Understand hand sanitation, wearing a face mask if at all possible, practicing distancing strategies to make sure that you're not transmitting or receiving the COVID-19 infectious disease.
Now, some folks have been critical of the timeline there. Some people say it's too fast or too slow. Everyone has a complaint or a praise. What is your response about that?
You know, I think it's just right. And so, yes, there are some who say it's too fast. Some say it's too slow. But listen, we're opening Texas as fast as possible while also containing the spread of COVID-19. Please understand this. If we were to open up all at once, that could lead to a massive increase in the spread of COVID-19 that would cause us to shut back down. As a result, we're trying to open up in very safe ways so that you will feel safe going out, but also you will not be transmitting COVID-19. So there's a lot of science, a lot of medical decision making that's behind this process, where we want our businesses to be able to open up, but we want to ensure that they will do so in very safe ways.
We definitely do. All right, Governor Greg Abbott down in Austin, always a pleasure. Thank you for joining us.
Thank you all.